Hello and namaste. On behalf of Apollo Hospitals, I'm delighted to convey our warmest greetings to all of you. Welcome to our corporate health series. This is Dr. Srinidhi Chidambaram here. A healthy body and mind is more crucial than ever if we want to create prosperous economies and a healthy planet. Knowledge is power, and we'll believe that our mission is to ensure that you stay aware and in control of your health so that you are poised to give your best at work, at home, and your career. So today, Apollo Hospitals is very happy to present a discussion with an expert on a very vital topic, hypertension. Hypertension or high BP or high blood pressure is when the force of blood pushing against your arterial walls or your blood vessel walls is consistently too high. This damages your blood vessels over time and can lead to a lot of serious complications like heart attack and stroke. And another word for high blood pressure is hypertension. This is very, very important to know because hypertension is a silent killer because you usually don't have any symptoms as such. So you may not even be aware that anything is wrong. And the damage, meanwhile, is still occurring within your body. It's also a very common condition with more than 1 billion people around the world who are now living with high blood pressure. And most of them are not aware of their condition. So there are a lot of risks for them, a lot of avoidable health complications. So we need to know all about this condition. In fact, World Hypertension Day is observed every May 17th in order to raise awareness and promote hypertension prevention, detection, and control. So we also at Apollo Hospitals would like to contribute to this day by presenting to you expert guidance on this very important health condition. I'm therefore honored to welcome Dr. Rajeeve Kumar Rajput to discuss the essentials of hypertension with us today. Dr. Rajeeve Kumar Rajput is a senior consultant, interventional cardiologist, and coordinator of the heart failure services at Indraprastha Apollo Hospitals, New Delhi. With over 3 decades of experience in cardiology, Dr. Rajput is a distinguished expert in his field. He holds fellowships in interventional cardiology and heart failure management, including heart transplantation from St. Vincent's Hospital in Sydney, Australia. His expertise spans a wide range of cardiac interventions, including angioplasty, stenting, pacemaker implantation, balloon valvotomy procedures, device implantations, and has contributed significantly to the field through more than 20 publications in indexed journals and has authored 6 chapters in cardiology textbooks. As a principal investigator in 7 multi-center trials, Dr. Rajput is indeed at the forefront of advancing knowledge of cardiovascular medicine and has served as a DNB teacher as well for 20 years, imparting his knowledge and experience to the next generation of cardiologists as well. His dedication to patient care, combined with his extensive experience and academic contributions, make him a trusted leader in the field of cardiology and someone who can give us the very best advice on hypertension today. Welcome, Dr. Rajeeve Rajput, for this session today. Thank you so much for joining us. So let's begin by talking about the basics. So what is hypertension?
Yeah, Dr. Srinidhi, the definition of high blood pressure has changed dramatically over last few decades. Initially, say if we talk about 1950s, 60s, 70s, people thought that blood pressure like 150, 180, 200 was normal in elderly people. But over the years, by long-term epidemiological studies, we have realized that the systolic blood pressure, or what we call as upper blood pressure, should be less than 140. And the lower blood pressure what we call diastolic blood pressure should be less than 90. So there is no consideration for age, males, females, or geographical area of country. Universally, any blood pressure of more than 140 systolic or more, or diastolic 90 or more, is hypertension.
So, what exactly happens in hypertension?
Well, the basic pathophysiology is hypertension is that to maintain vital perfusion to different parts of the body, every individual needs a particular level of blood pressure. In hypertensives, for various reasons, most of them unfortunately are not clearly defined, but this set point is set at a higher level. So most of the time, what we call as essential or primary hypertension is hypertension without a cause. That means you do investigations, and in 90% of patients, no causative factor can be found, and we call as essential hypertension, simple hypertension, or the common hypertension. In 10% cases, especially if the blood pressure is very, very high, or if it starts at very late age, or if it starts at very early age, or if there are some other findings, we call it secondary hypertension. Secondary hypertension means it is secondary to something like hormonal problems, like blockages in the blood supply to the kidneys, coarctation of aorta when there is a narrowing in the main blood pipe. So these are secondary hypertension, but this constitutes only 5 to 10% of the patients. In 90%, it is essential or primary hypertension. By primary, it is very important to understand there is no cause. So definitely, if there is no cause, the medication or the treatment strategy has to continue for long term.
So, we often know that hypertension, high BP can be a silent killer. So, why is it so? Why should it be a silent killer?
Now, that's probably the most important aspect of high blood pressure. In most of the cases, it can go unnoticed. Sometimes there are no symptoms at all, or sometimes there are symptoms which can be missed by a patient or can be misinterpreted because of something else. Let me share with you the commonest symptom is headache. And you know, there are so many other causes of headache. Many people attribute to eye problem, cervical problem, tension headache, migraine, etc. So many times it can go unnoticed. Now, if your blood pressure is high, whether you have symptoms or you don't have symptoms, the target organ damage. Now, that's a very important concept in high blood pressure. The target organ damage, that means damage to the brain, heart, kidneys, and blood vessels supplying blood to the extremities and all other major organs. The damage continues to happen. So if you are hypertensive, if your blood pressure starts getting up today, even if you don't have symptoms, the damage starts today. And then if you, for some reason, if it is allowed to remain high for long durations, longer the duration, more will be the damage. Silent killer, as you can understand, is when the patient is not aware that he is having something which is damaging his vital organs of the body. That's why it is called silent killers. Many times when patients comes with heart attack, comes with a stroke, or with kidney problem, we ask them, are you having high blood pressure? Because we are getting high blood pressure now. And they would say, no, I don't have high blood pressure. And then when you dig a little deeper, they would say, yes, it was there few years back, but then I didn't bother about it, or I did not follow it regularly. So that's why it is a silent killer.
So now coming to what are the risk factors for developing? I mean, I know you did explain that there are some causes and sometimes essential hypertension doesn't really have a cause. But are there any specific age groups that it affects?
Well, the pathophysiology or the reason for so-called common blood pressure or essential blood pressure is still not very clear, but there are some factors. And the most important factor is genetic predisposition. If both of your parents have high blood pressure, especially if the blood pressure starts early age, say 40s, 50s, then offsprings have a higher chance of developing blood pressure. Secondary, though there are some risk factor clusters, like if you are overweight, if you are diabetic, if you are a smoker, if you are physically inactive for any reason, if your body mass index is higher, then this is a group which has got higher chance of developing blood pressure. I'm not mentioning about those secondary causes, like if you have Cushing syndrome or some endocrine problem, or if you have blockages in the blood supply to the renal arteries, or those are the specific like pheochromocytoma, tumors involving the adrenal glands. So they are a small subset of secondary causes, but most of the time it is genetic predisposition and other risk factors which I just mentioned.
Another common misconception, which I don't know if it is a misconception, but people often think that since we say hypertension, and there is a common usage that, you know, the BP goes up when you're tensed up. Is there a connection between tension and stress in the development of hypertension?
Well, there is some connection, but I would like to highlight at this point that, it is not the main factor. The main factor still remains genetic and other risk factors, because we all know that there are various corporate people, professionals, even normal people who are doing so much in their life, making decisions, going through the stress. All of them don't develop hypertension. So stress is is an important factor, but is not the most important factor. However, it has been seen and is emerging a broad group of psychosocial stress. If you are not happy with yourself, with your family, with your work, with your earnings, with your career, etc. So that's a broad group of psychosocial stress. If you don't have friends, if you're living alone, and often these are the patients where the other risk factors like lack of exercise, smoking, alcohol will be more common. So I think it's stress does play a role, but it is not like the most important factor.
So you were mentioning about smoking and alcohol, which is again somewhere related to stressful careers and corporate lives, and you know, quite often people use that as a kind of an excuse to indulge in these kind of behaviors. But at the same time, of course, we know about their uh, health implications. So, what role does smoking or excessive alcohol consumption have in the development of high blood pressure?
I think smoking has a very important role in overall cardiovascular diseases, high blood pressure, as well as chances of developing blockages in various vital organs if you are hypertensive and if you are smoking. So the risk is more than double. So that's one factor. Coming to alcohol, I think it is, let me put it that way. If you can do away without alcohol, that is the best thing. There's nothing like good dose of alcohol. I won't advise that, you start drinking wine or alcohol to keep your heart healthy. It is the other way around. If you have been drinking all your life, and if you want to drink, if you enjoy a drink or two, that is not harmful. That may not be harmful, but nowhere in our textbooks it is written it is helpful. So, to answer your specific question, there by some epidemiological and observational studies, there is a consensus that if you drink around 50 to 60 ml of alcohol, which is 40%, and then you drink 3 to 4 times a week, that is probably the safe limit. Now, if you a little going a bit deeper, whiskey has 40% alcohol, most of the whiskeys. Wine has 14% alcohol. Beer has 4% alcohol. So 50 ml of whiskey would be equivalent to 500 ml of beer, will be equivalent to a glass of wine. So most of our young colleagues, what they do, they say, I'm not drinking whiskey, it is bad. But they consume large amount of beer and wine. So it's not it's not helping them. So alcohol content matters. So if you are drinking less concentrated liquors like beer, that even then amount should be, or the volume should be checked.
Right. And as you yourself said, most people miss the signs or symptoms of high BP. They don't know, or they don't know what to look out for. And especially if one is constantly busy in work, again, these symptoms can be quite. I mean, it can be due to other causes as well. If, for example, if somebody has repeated headaches, they would probably think that they're looking at the screen, or they're not sleeping well, or having long hours at work. So, what are the key signs and symptoms that somebody must be aware of? Or how do you even detect, or is there some way to screen yourself regularly? How do you even come to know that you have this problem?
I think to answer your question in a holistic way, the best way is periodic checkup, even if you don't have symptoms. But coming to specific question about symptoms, the commonest symptom, as I mentioned earlier in my discussion, is headache. So we generally believe that if your eyes are okay, if you don't have a refractory error, the commonest cause is high blood pressure. And we believe that if somebody, especially a male patient, is coming with headache, we presume it is hypertensive unless proven otherwise. But other common symptoms are more fatigue, easy fatigability, not feeling well, palpitation, breathlessness, anything which is unusual. Most of our patients would come and say, besides headache, I'm not feeling well for last few months. I don't feel as comfortable or as normal as I used to feel. So these are the warning signals. Of course, shortness of breath, palpitation, chest pain, and they would appear only when blood pressure has damaged some of your vital organ.
Now coming to actual measuring of the blood pressure. You were saying that regular checks are important. So does this have to be at a clinic or at a hospital? Or this is one thing that can be monitored well at home as well. So we have a lot of equipment now that people can easily use. So what would your recommendation be, doctor, for those who are not suffering from hypertension and who are just screening, and for those who have been diagnosed, what kind of monitoring should be done?
I think I'll answer this question in a complete way. Listen, if you whenever medically it has been known that when a patient comes to a clinic or a hospital, there is a good chance that his blood pressure may be artifactually high, and we all know it, white coat hypertension. So it is possible that you are not hypertensive, but when you go and visit a doctor, your blood pressure is high. So that's why it is recommended that one should never diagnose blood pressure in a first visit. So there should be higher readings, at least 2 to 3 readings, at least few days apart, in a blood pressure which is measured in a as advised. Like, patient should be stress free. He should not have a smoke or taken a coffee within half an hour. He is comfortable. He has not rushed through his work and just coming to a doctor. He is seated comfortably. the instrument is okay, and the cuff, the blood pressure cuff length, everything is important. So when you take all these precautions, even then you need a couple of readings, in fact more than a couple of readings, to diagnose hypertension. That's point number one. Point number two, as far as the screening is concerned, there is growing realization around the world that home blood pressure monitoring or the blood pressure monitored by non-medical, when a doctor is not measuring it, they are being accepted more and more. And in fact, the way to go about is more frequent monitoring by automatic devices. In last 15-20 years, there has been a lot of improvement in their accuracy, and it's a useful technique that you ask your patients to bring their machine along with them, and you measure your blood pressure yourself, and then you measure with the machine, and then you can calibrate them. But the way to go about, because if there are thousands of people, you want to measure blood pressure in a population, large number, millions of people, you will require too much of health infrastructure. But a simple automatic machine can measure blood pressure in many more number of patients and can pick up those cases. Sometimes when happens, there's an obvious discrepancy. Patient comes, his blood pressure is high, and he says, but doctor, when I measure at home, it's always normal. Or other way around. So in that situation, supplementing your clinic visit with the home visit is the way to go. And this home visit can be in India, can be ambulatory blood pressure monitoring by a machine, would be a frequent blood pressure measurement by a trained paramedical staff, or even family members, and automatic machine. So whatever way you use, frequent measurement will help us in arriving at a diagnosis whether the patient is truly suffering from blood pressure, and if he's a patient of hypertension, whether his blood pressure is controlled or not.
The other thing is lifestyle modification helping in preventing blood pressure. So things like dietary modifications or exercise or sleep hygiene. So what role do these kind of things play? And then, of course, the wellness aspects like yoga and meditation. Do they have any role at all to play in preventing or?
This is the most important question you have asked about this whole thing, because lifestyle modification is the most important and the first step in managing patients of high blood pressure. And often we see that patients start medication without properly implementing lifestyle modification. But actually, what actually is lifestyle modification? It essentially comprises of 5-6 common things. And the most important thing I want to highlight today is reduce your salt intake. Normally, we eat at least twice or thrice the amount of salt what we should normally eat. The second S is smoking. Salt, smoking. Tobacco consumption in any form, oral or smoking or anything, is a strong no for good blood pressure control. Third S is stress. As far as possible, keep your life simple. And then the next step is regular physical activity. Whatever you can do, swimming, jogging, cycling, walking, whatever you can do. Regular physical exercise, keep your weight under control. There are various ways to measure your weight, like kilograms, pounds, and body mass index, and waist hip ratio. Whatever you use, keep your weight under control. And most important is, uh, uh, you know, keep yourself mentally and physically fit.
So, are there other diseases and conditions that might predispose somebody to get hypertension? As in, there are other lifestyle diseases, non communicable diseases, so diabetes, or of course, you already mentioned about obesity. or kidney disease. So what would be the other conditions that must alert somebody that they might be at risk for developing hypertension?
There are various diseases, but I think, as a broad rule, I would like to mention two, three common situations. And first is diabetes. Diabetics as a group are more likely to develop hypertension. And if they develop hypertension, they are more likely to develop target organ damage. So, diabetes and blood pressure is a very deadly combination. It is not 1 plus 1, 2, it is 1 plus 1, maybe 5 or 6. So, that is one thing. Second, those patients who have endocrine problems like Cushing's, they're not very common, but they're not very uncommon also. So, a set of endocrine diseases and kidney diseases. Even in early stages, if somebody has mild CKD, chronic kidney disease, these patients are more likely to be hypertensive.
Also about medications. So, are there any medications that uh, can have an impact on the blood pressure? Because there is another tendency that nowadays we have that people just buy medication and pop it without even a prescription, or they keep having something, they buy painkillers and they have it at will. So, are there any medications that one must be aware of?
Yeah, I think there are 3, 4 medications which comes to my mind, and the commonest is long-term use of painkillers. And we see, especially in our elderly population, when they have various osteoarthritis and they have chronic pains, they often consume large amount of analgesics on a regular basis. Second is very common allergic situations where you use nasal sprays, which contain some compounds which can increase your blood pressure. And rarely, some patients are on chronic steroids that can also increase blood pressure. These are the common situations. There are other situations, other medication also, but they're not so common in a healthy person.
Talking about medications, how is blood pressure treated with medications? What kind of medications are given? I mean, I know the topic is vast, but maybe a broad overview.
Yeah, I think I would just like to say that there have been huge improvement in safety and efficacy and tolerability of blood pressure medication in last 2 decades. The medication which you were using 20, 30 years back and now are totally different. So broadly, there are 4 classes of drug which we often use: A, B, C, D. A is angiotensin receptor blockers, B is beta blockers, C is calcium channel blockers, and D are diuretics. So unless somebody has a specific heart problem like chronic blockages or heart failure, then we normally use either calcium channel blocker to begin with or a angiotensin receptor blocker to begin with. If one is not enough, you can combine the two. If two is not enough, you can use 3 or 4. And in some patients, we require 4 or 5 medication. But the most important, the reason is that the blood pressure medication has to be taken over a long period. They're not short-term medication. So medication has to be convenient dosing schedule, at the most once or twice a day. They should not be very costly, and they should not be causing side effects so that patients can take them for years and years together. Say, for example, 30, 40 years back, all of us were using diuretics as the first antihypertensive medication, but they had obvious problem. So they are not the first group of the drugs to be used. But angiotensin receptor blocker like sartans, telmisartan, etc., these are the medication which has almost 99% safety profile, what we call as placebo-like drugs. And these medicines, millions of people are taking every day for n number of years without any side effects.
So that brings me to some specific questions on people who are working in a corporate environment. So if they are diagnosed with hypertension, is it possible for them to have a normal, productive, successful life ahead?
Oh, yes, absolutely. Blood pressure, and if you follow your doctor's advice, should not come in way of your career or your professional career. It's absolutely fine if you take your medication in time, if you see your doctor in time, and if you follow simple, basic lifestyle rules, you should be able to control your blood pressure very effectively. There are so many successful, even those persons who have very demanding physical, schedule, busy schedule. It is absolutely possible to have normal blood pressure and with proper medication and lifestyle.
Thank you so much, Doctor, for this wonderful discussion. Dear viewers, I hope you've had a complete overview of hypertension. So, to sum up, we said that it is a serious and silent condition that can sneak up without you knowing. So, having your blood pressure checked often, learn your numbers, knowing your blood pressure levels, monitoring it regularly is the first step towards making that difference to your health. And of course, building healthy habits into your regular routine, regular exercise, a salt reduced diet, all this is definitely going to help. And of course, as doctor said, you can have a very normal, high quality life as long as you manage your blood pressure with the right lifestyle changes and the right medication and monitoring. So do reach out to us at any time at all for further queries, and we are present in all the social media channels as well to respond to any questions that you may have. And of course, you can walk into any of our hospitals and clinics for your consultation and care. Thank you.
Thank you.